Hey there! If you or someone you know is dealing with major depressive disorder or MDD, understanding your medication options is crucial. Today, I'm breaking down the different classes of medications used to treat MDD. First up, we have selective serotonin reuptake inhibitors, SSRIs, including Prozac, fluoxetine, Zoloft, sertraline, Celexa, citalopram, and Lexapro, escitalopram, are often prescribed first for MDD as they tend to cause the fewest side effects. Serotonin norepinephrine reuptake inhibitors, SNRIs, such as Pristiq, desvenlafaxine, Cymbalta, duloxetine, and Fetsima, levomilnacipran, are another common group of drugs used to treat depression as well as anxiety. Tricyclic antidepressants, TCAs, include amitriptyline anafranil clomipramine and norpramine desipramine. Monoamine oxidase inhibitors, MAOIs, include Marplan isocarboxazid, Nardil phenelzine, and Emsam selegiline. Atypical or miscellaneous antidepressants that don't fall into the other drug classes include Wellbutrin, bupropion, Remeron, mirtazapine, nefazodone, trazodone, Trintellix, vortioxetine, and others. NMDA. Receptor antagonists include only Auvelity, dextromethorphan, and bupropion, the first oral NMDA receptor antagonist approved to treat MDD. What is the most effective medication for MDD? A study of over 500 trials, which included over 116,000 individuals, analyzed 21 different antidepressants used to treat depression in adults. Within head-to-head studies, some of the most effective drugs were amitriptyline, Lexapro, mirtazapine, Paxil, Effexor, and Trintellix. Still, the analysis concluded that all antidepressants were more effective than placebo, a treatment with no active properties that's given to a control group in trials. This supports the practice of trying different medications for different individuals and the likely need to try more than one before finding the best option. Another analysis of depression in children and adolescents included over 70 trials, more than 9,500 participants, and primarily moderate to severe cases of depression. This analysis looked at 16 antidepressant medications, 7 psychotherapies, and 5 combinations of antidepressant and psychotherapy treatments. Prozac, fluoxetine, either alone or in combination with cognitive behavioral therapy, CBT, seemed to be the best choice for this population. 6. Sometimes treatment with one medication isn't enough to help with symptoms of depression. You may experience a partial response to a medication where your symptoms improve but not as much as they could, or maybe some symptoms still linger. If this happens, you and your healthcare provider may try a different medication or add another medication to your regimen. The following are second-generation antipsychotics that are FDA approved as add-on therapies to an antidepressant for treatment-resistant depression, TRD, Seroquel, quetiapine, or Zyprexa, olanzapine. Finding the right medication often involves some trial and error. Also, pharmacogenetic testing, such as GeneSight, might help in selecting the best medication for you. Finding the right medication to treat your MDD may take a couple of tries. Your healthcare provider may start with a certain drug based on other issues you may be struggling with, such as anxiety or trouble sleeping, or based on their own experience of successfully treating other individuals with depression. It's important to note that it sometimes takes up to 8 to 12 weeks of consistently taking antidepressants as prescribed to see their full benefit. 2. This may sound like a long wait time, but it is necessary to determine whether a medication is a good fit for you, or whether another option may be better. One option to consider that may help you find the best antidepressant medication and minimize side effects is pharmacogenetic testing. This is a somewhat new field where genetic information is collected that may help guide healthcare prescribers in choosing the ideal medication for you. One study, including over 1,500 people, found that prescribing medications based on the results of a 12-gene test significantly reduced side effects versus standard care guideline-based treatment. Pharmacogenetic testing is not a sure bet, but it may lower your risk of medication-related side effects and lessen the time it takes to find the best medication option. Talk to your healthcare provider if you are curious about pharmacogenomic testing and whether it may optimize your treatment. Remember, medication is just one part of the treatment puzzle. Therapy, like CBT, is also important. Lastly, antidepressants can come with a warning about increased suicidal thoughts, especially in younger people. Always discuss the risks and benefits with your healthcare provider. And if you or someone you know is in crisis, call the Suicide and Crisis Lifeline at 988 or dial 911 for immediate help. Thanks for watching, stay informed, and take care.